Good morning. Welcome to our 10th anniversary celebration of our Smiles for Kids program. I'm Elaine Loyak, Vice President of Community Engagement and Government Relations for Delta Dental of North Carolina. And on behalf of our company and the Delta Dental Foundation, thank you for taking time to be with us this morning. I want to give special thanks to members of the Foundation's Board of Trustees, members of our Board of Directors, our elected officials, and of course, our 2021 Smiles for Kids grantees. Now, here to tell you more about the Smiles for Kids story is our President and CEO, Kurt Laddick.
Thank you for joining us to commemorate the 10th anniversary of the Smiles for Kids program, but more importantly, to recognize the amazing grantees across this state who are helping at-risk children and families receive access to oral care services. At Delta Dental, we believe everyone deserves a healthy smile. Not some, not most, but everyone. It's part of everything that we do. When I came to North Carolina 10 years ago to be with Delta Dental, I learned that 37% of the children in North Carolina entering kindergarten have tooth decay, and a third of them are missing critical class instruction time over their educational lifetime. Tooth decay is a preventable disease, and we had to do something about it. So, working with the Delta Dental Foundation, I initiated the program called Smiles for Kids because of the tremendous work that we've been able to do with our customers to provide more funding to help at-risk children in this state. I'm pleased to say that to date, through this program, we have now helped over 300,000 at-risk children and families from the mountains to the sea receive oral care services or oral health education that they otherwise would not have received. Now that is something to smile about.
Thank you, Kurt. We're delighted that you'll next get to hear from Dr. Leah Devlin. Dr. Devlin is a professor at the University of North Carolina Gillings School of Global Public Health, chair of the Board of Directors of the CDC Foundation, and a member of our Board of Directors. Dr. Devlin?
Good oral health is important for every person, but it's really important for children. It's important for speech development. It's important for good nutrition. Good oral health is important for our appearance and how we feel about ourselves, how we present to the world, and these are all developing young persons. It's also important for school and for education. Dental disease is one of the most frequent reasons that children miss school. And if you think about it, it's really hard for a child to not only be present, but to pay attention, to be able to do their work when they're in pain. So that's really something that we need to focus on with our young children. It's also important to remember that oral health is a part of total body health. And we tend as a society to accept diseases and infections in the mouth that we wouldn't tolerate somewhere else. And one affects the other. One of the examples that you'll see in the Smile for Kids grants is that they're working on improving oral health for pregnant women because we want new moms to be healthy and we want that little baby to be born healthy. So good oral health is important for total body health. So it's very exciting that the Delta Dental Foundation has invested for 10 years in the Smile for Kids grants. They provide resources for a number of community organizations, local health departments, community health centers. The North Carolina Dental Society is involved. All of these entities are working together to improve oral health for the children in their areas. And it's rural, it's urban. We know we can accomplish more together, and these relatively small grants are really important in catalyzing partnerships, in bringing additional resources to the table, in providing innovative approaches to improving oral health for children in North Carolina. And Some of these projects, they're very exciting. They have drive-through opportunities, mobile dental clinics. Some are providing screenings. All of them provide education. And some of them go so far as to place sealants and varnishes, which are two very important preventive but clinical services. So it's very exciting to see the work that Smile for Kids is catalyzing in community to improve the oral health for children. And it's a really important role for philanthropy to be partners in this kind of work. And it's what's so exciting about the Delta Dental Foundation, that they see the importance of this problem and are bringing so many people together to help find solutions.
Thank you, Dr. Devlin. Next, I'm excited that you're going to get to hear from two of our Smiles for Kids grantees, Wake County Human Services and Wilkes Public Health. Wake County Human Services is the only Smiles for Kids grantee to have received a grant each of the 10 years since the program's inception. Representing Wake County Human Services is Dr. Rebecca Sykes, Dental Director, and from Wilkes County Public Health, Dawn Jolly, Registered Dental Hygienist, and Assistant Director of the Dental Clinic and Mobile Program Manager.
Hi, I'm Dr. Rebecca Sykes, and I'm the Dental Director here at Wake County Human Services Dental Clinic. Our clinic provides comprehensive dental care to Wake County children birth through 20 years. We also provide dental treatment on a sliding fee scale for the uninsured based upon family income and household size. It has been our privilege to have been recipients of the Delta Dental Foundation's Smiles for Kids grant for the last 10 years. We have been able to provide 3,300 sealants to over 750 uninsured and underinsured children, a treatment that many would not have been able to receive due to financial barriers. It is our goal to provide 325 sealants to approximately 100 children in efforts to continue our mission of providing access to care for the underserved.
I am Dawn Jolly. I'm with the Wilkes Public Health Mobile Dental Clinic program. Our clinic has been recipients of the Delta Dental Foundation Smiles for Kids grant for several years now. We really appreciate everything that Delta Dental Foundation has done for us. Typically, our program uses the funds from the Smiles for Kids grant to basically all the funds go directly to patient care. We don't use it for supplies or anything to do with managing the company or facilities issues. We try to reach as many children in our county that we can who don't have dental coverage, who don't have Medicaid or any funding available to them. So we have a lot of help from the Wilkes Public Health School System, the county health department, to try and identify the kids who have needs that aren't met with dental issues. Typically, we will contact those parents either by phone or mail, and then we will ask them to bring the children in for appointments, and we will do their dental treatment as much as we possibly can. For anything, sometimes it's just preventive that they need, sometimes it'll be operative. We do full service dentistry here. We also will do referrals if they need that to a specialist, depending on what their particular dental needs are. We utilize these funds not only in our main office, but also on the mobile dental clinic. We see kids pre-K through 12th grade, and we will identify kids in the school system who, again, don't have any dental coverage or any way to even get to a dental appointment. So we're fortunate to have the Delta Dental Foundation funds helping us with treating those kids who otherwise would not even be able to make it to a dental appointment by utilizing our mobile clinic. And we also provide full service dentistry on the dental truck as well. So stainless steel crowns and other preventive treatments, operative. Again, we do utilize those funds just to treat whoever has a need for it. All the dollars go directly to help take care of that patient's care. thank you everyone for joining us and for giving us a little bit of your time. And I'm going to head you back to Elaine. Thank you again.
Thank you, Dawn. Next, we're going to recognize our 2021 Smiles for Kids grantees. Alice Aycock Poe Center for Health Education, America's Tooth Fairy, the National Children's Oral Health Foundation, the County of Moore, Cumberland County Department of Public Health, the Dental Foundation of North Carolina, Discovery Place Incorporated, Enola Group Early Head Start, Goshen Medical Center Incorporated, North Carolina Community Action Association, North Carolina Dental Society Foundation, Orange County Health Department, Pitt County Health Department, Reach Out and Read, Carolinas, Rowan County Department of Public Health, SOAR Outreach, the C.W. Williams Community Health Center Incorporated, Transylvania Public Health, Upper Coastal Plain Learning Council, Wake County Human Services Dental Clinic, Wilkes Public Health Dental Clinic, the Wilmington Children's Museum Incorporated, and the YMCA of the Triangle area. Thank you again for joining us this morning to celebrate 10 years of Smiles for Kids. I want to give a special thanks to our speakers, Dr. Leah Devlin, Dr. Rebecca Sykes, and Dawn Jolly. Thank you and have a wonderful weekend.